So, when we're managing PN patients, we need to consider several factors. First, as you just heard from Brian, the pathophysiology of PN is incredibly complex and it reflects both cutaneous neuro and immune dysregulation, as well as systemic disturbances. And when we think about approaching a PN patient, we need to be mindful of the appropriate diagnostic workup. So we need to consider the duration of symptoms, the medical comorbidities such as diabetes or chronic kidney disease, chronic liver disease, as these patients may be at increased risk of having those disorders. And we really need to be doing a complete review of systems. Another general consideration is just knowing that you are likely going to have to incorporate multimodal therapy. And multimodal can mean several things. It can include using a combination of topical therapies, systemic therapies, or widespread skin therapies. It can also reflect the fact that you will need to be using agents that can target the neural component of the disorder, as well as the immune component. And again, those are not necessarily two different things. So one medication may hit both targets to some extent, but at times, particularly with some of the conventional or traditional methods for treating PN, you might need to combine these. A key point in PN management is that a treatment must be tailored to the individual. There is no one right way to manage a patient who is struggling with prurigo nodularis. You must consider age, the medical comorbidities we've already discussed, potential drug interactions or side effects of any given agent that you're using, and really the complexity of the regimen. And again, that's a reflection of the fact that you often need to use more than one agent when managing these patients. Because of the complexity of management, it's really critical that we pay very special attention to counseling patients. This is a disorder that often takes a lot of time to address, not only the therapies themselves, but also just acknowledging what the patients have gone through and the skepticism that often will come along with this disorder because patients have failed many medications. And then finally, as I think Brian alluded in his presentation of his patient, many of these patients struggle with depression and anxiety as well as sleep loss. You have to address those in your management of PN patients.